Hello, good evening. Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to our afternoon Tuesday open clinic. Today we're talking about endometriosis. Endometriosis. This is a very important and common condition which has fertility implication in women. Matter of fact, globally, about 1 in 10 women will present with this condition. So it's very important, and I want you to please make yourself comfortable. And as soon as we have a good number, I'm going to start. Our clinics are every Tuesdays, 6:30 p.m. Eastern Time US, 11:30 p.m. Nigerian time. Immediately after this clinic, I will run another clinic in Facebook. So I want you to join me in Facebook immediately after this clinic. I will repeat exactly this topic. This evening, we're going to look at the possibility of achieving pregnancy if you have endometriosis. And for us to understand what we need to do, we have to first of all understand the concept of endometriosis. So I'm going to help you to understand that. So that please, when you come in, let me know who you are. So tell us your name, tell us your location, confirm you can see me, give me a thumbs up. Okay, now we have clinics also on Saturdays. Saturday's clinics come up a little bit earlier, 12 p.m. Eastern Time US, 5 p.m. Nigerian time. So if for some reason you're not able to pick up on Tuesday, always come back on Saturday. You will also see us talking about the topics that we love. Now let's talk about endometriosis. So endometriosis is a very painful condition. So I want to start with the pain pathway. Women that have endometriosis will have severe, painful pelvic pain. The condition happens when the cells ordinarily only supposed to be limited to the cover of your womb, which is called the endometrial cells. The only place that God originally planned that your endometrial cells will be located is on the cover of your womb. However, in endometriosis, for some strange reasons, we will discover these endometrial-like cells outside the endometrium, outside the womb. The commonest place to have endometrial cells outside the womb is in the ovaries, the fallopian tubes, and other pelvic organs. The problem with endometrial cells is the fact that ordinarily there are certain changes that happen in your body, in your cycle. If pregnancy didn't happen, if the egg did not fertilize, and at the end of the month, the womb is going to go into weeping mode. The womb is going to go into mourning. When the womb is going into mourning, pregnancy didn't happen, the cover of the womb will disintegrate. Part of the cover of the womb that disintegrates that will eventually pass out as you're bleeding is the endometrial cells. There is an opening for the blood to leave. However, in endometriosis, because the cells are limited in the ovaries, in the tubes, in other pelvic organs, when the time for bleeding comes, those cells in the ovaries, in the tubes, in the pelvic organs will start bleeding. Unfortunately, because there is no avenue for bleeding to escape from the ovary, to escape from the tube, the bleeding will be retained in the tube, in the ovaries, in the pelvic organs, and they will be there and they will start causing damages. This is why you will experience pain. Anytime we have collection of blood in the body, especially bad blood, we want it to leave our body. So that's why for some women, during their bleeding, you will notice you will have pain. Why do you have pain? Because inside those slot of disintegrated part of the cover of your womb, you also produce a substance we call prostaglandin. So the major reason why you will normally have pain during your bleeding is because of presence of prostaglandins. But the problem in endometriosis that causes a lot of pain, the blood that bleeds in the ovaries cannot come out. So they will be in the ovaries, leading to a condition we call endometrioma. So endometriosis of the ovaries is called endometrioma. They will be in the ovaries, they will start damaging the architecture in the ovaries, they will start forming adhesions and ultimately affect the function of your ovaries. Remember, your ovaries are supposed to be the place that the eggs will eventually develop through the follicle. You release your egg, then you become pregnant. So indirectly and directly, endometriosis of the ovaries will lead to poor ovulation and indirectly and directly lead to infertility. If it happens in the tube, it will also damage the tubes through the process of forming adhesions. Adhesions are scar tissues that damage the body. So these are the major reasons why women that have endometriosis will struggle. So the inability of the blood to leave the ovary, to leave the tube, to leave the pelvic organs will start leading to adhesions, will start causing irritation, will start having problems. Now, this particular condition can be misdiagnosed. There are some women that will have endometriosis and we might think it's PID, pelvic inflammatory disease, or we might think it's ovarian cyst. Now, some women can also have endometriosis elsewhere in the body. If it happens in your gastrointestinal system, it might look like you have what we call irritable bowel disease. Very painful condition. Now, if you notice, some women during their bleeding, they will start bleeding from their navel, their belly button. That's also endometriosis of those umbilical area. Now, the signs and symptoms of endometriosis might be temporal. Sometimes it might improve with pregnancy. It can go away completely, especially after menopause. And sometimes you need to get help. The biggest presentation in endometriosis is super heavy bleeding with excruciating pain. The pain in endometriosis might be 10 over 10. So when we are grading pain, we grade from lower level of 1 to 10, 1 being the highest pain. Women that experience endometriosis will have pain level of almost 10 over 10. It's a very painful condition. Unfortunately, it's common. Out of every 10 women, 1 will likely have endometriosis. Now, besides the cramp and the heavy periods, women that have endometriosis might also present with pain during sex, pain during defecation, pain during urination, pain just anytime you go to use your pelvic organs. Now, what's the management? Thankfully, the fact you have endometriosis doesn't mean you cannot become pregnant. You can still become pregnant, but guess what? You need a fertility specialist. Endometriosis is a known cause of infertility. There are different ways of managing this. We can use pain medication because pain is part of the major problems you will have. Some women, unfortunately, will go for surgery. Some women will embark on hormone therapy. So in as much as you might have endometriosis, the fact you will still become a mother is top on the list. Now, the ability of you to achieve pregnancy without treatment in endometriosis is dependent on the severity. So if you have the mild form of endometriosis, you can conceive naturally and you won't have a problem. Now, 75% of women that have advanced stages of endometriosis, which is stage 3 or stage 4, will need help. What type of help? Assisted reproductive technique. If your endometriosis is stage 3 or 4, which is advanced, you might likely need IVF, which is one of the best ways to achieve pregnancy. So even having endometriosis should not stop you from still pursuing your family, then you need help. It's very important you understand what I'm talking about. Endometriosis is a big player in infertility. So once we notice you have endometriosis, you must go to a fertility specialist. We must begin you on pain management, hormone replacement therapy, surgery. We must do everything possible to see if we can help you. So many studies have shown that the amount of endometriosis we normally see when we go for laparoscopy will be correlated to the future infertility. So if you're blessed and your endometriosis was diagnosed on time, that means it's in stage 1, is a minimal disease, then you have just few implants. That means you have few endometrial cells with no scar tissues, and you can achieve pregnancy. When you begin to get to stage 2, which is mild disease, you will have more implants, less than 2 to 3 cm, 3 inches in your belly, and some of them, to an extent, might involve scar tissues. The problem starts when you get to stage 3. Stage 3 is moderate disease. This is why you need to be careful, because at this stage, you have extensive endometriosis in the abdomen. It might be deep. It might create a pocket of cells. It might create a pocket of places that fluid can accumulate, even in the ovaries, and they will begin to damage structures. When you get to stage 4, which is the advanced stage of endometriosis, this is where so many damages are happening. Large endometrial cysts in the ovaries, scar tissues, and the problem with scar tissues, anywhere we have scar tissues, they tend to join parts of the body together. So if we have scar tissues in the ovaries, it will tend to join the ovary, and it will gum the ovary with the tube, and the tube can no longer perform its role, and the ovaries can no longer perform their role. So the problem with endometriosis is to lead to scar tissues, which when it happens, it will affect the function of that particular organ. Women that have stage 1 and stage 2 endometriosis can become pregnant by themselves. They might not necessarily need any intervention, including laparoscopy, to become pregnant. So stage 1, it's more manageable. When you begin to get to advanced stages like stage 2, stage 3, and you get to stage 4, then that's where we need to be very careful, especially if you are above 35. We need to be very aggressive, so more medication, because pain is a very big player in endometriosis. So the more you present yourself to a fertility specialist and you yield to superior management, the more you're improving the possibility of having successful pregnancy. So once we have diagnosed you have endometriosis, you can no longer be by yourself. You can no longer stay and be going for treatment under any doctor. You need a fertility specialist. We need to do everything possible to give you the best approach. Some women, we might give them ovulation induction drugs, because when you have endometrial cells in the ovaries, it will damage the function of the ovaries. So some women, we can actually give them Clomid for 5 days. And if ovulation happens, we can also induce production of the sperm, and we can see if we can go for IUI. So IUI, it's also a likely option in women that have endometriosis, but it's your provider that will decide. If IUI works for you, especially if you have stage 1 and 2, then go for it. If this treatment is not successful after 3 or more months, the next step is to go for injections together with IUI. Then if it fails, you go for IVF. If you have stage 3 to stage 4 of endometriosis, that's advanced endometriosis. If pregnancy doesn't happen within 6 to 12 months, surgical treatment is recommended. Surgical treatment and hormonal treatment is recommended together with pain management. Overall, the best management, the best treatment that will yield result for women that have endometriosis is IVF. So you're a very top contender of IVF. And I encourage you to go above and beyond to do what you need to do so you will become pregnant. That's my presentation. Now I'm going to open the clinic. Please, if you have questions, feel free and ask your questions, especially if you have diagnosis of endometriosis. This is your opportunity. Please start asking your questions. The clinic is open now. I'm ready to take your questions. Remember, immediately after this clinic, join me in my Facebook page. and I will attend to you. Philomena Pedro from Abuja, thank you for coming. Chinanya Echebiri, also from Abuja, thank you for coming. Please feel free and ask your questions. Let me provide you feedbacks. It's time for questions. Do you have any questions? Remember to register for the event coming up on Sunday. Gender Selection Masterclass. And that's my wife, my beautiful, amazing wife, very intelligent. She has a question. Can endometriosis affect fertility? Yes. Endometriosis is a big player in fertility because remember, the process of pregnancy happens when your hormones are performing optimally, when your vagina is good, when your cervix is good, when your womb is good, when the tubes are good, when the ovaries are good. So depending on the severity of endometriosis and the location of endometriosis. So if you follow my presentation, there are 3 commoner sites where endometriosis will occur: the tubes, the ovaries, and other pelvic structures. So remember the function of your tubes. So if we have stage 4 or stage 3 endometriosis in the tubes, what will it do to the tubes? It will damage the tubes. How will it damage the tubes? The accumulation of bleeding, which will happen when your bleeding will go and damage your tubes, leading to adhesions, leading to scar tissues. What happens when there are adhesions and scar tissues in the tubes? The tubes are damaged. The tubes are blocked. The tubes are no longer going to function. The tubes might be predisposed to having ectopic pregnancy. Now, if you have endometriosis, extensive endometriosis in the ovaries, it will lead to endometrioma, which is a collection of endometrial cells in the ovaries, which will affect the function of the ovaries. So both directly and indirectly, the formation of scar tissues, the inability of the ovaries to perform its role will affect fertility. This is why you need a fertility specialist. So you can go through the 3 modalities of management. Pain management, because endometriosis is very, very painful. Take it from me. Then you go for your hormone therapy and ultimately surgery. So majority of women that have extensive stage 3 to stage 4 endometriosis will eventually require surgery. The essence of surgery is to remove all those endometrial cells so we can improve your fertility. So yes, babe, when you have infertility, we have to rule out the fact that you might likely have endometriosis. Okay, can you ask your questions? Of course. Even if it's not related to this topic, feel free and ask your questions. We still have a couple of leeway regarding time, so the questions are going to drive my feedback. So Nabila, you can go ahead and ask your questions about fibroids. Make it very simple and straightforward. Philomena and Chinaya, do you guys have questions? This is your opportunity. You don't see me every day, so when you see me, make good use of that opportunity. Ask your questions, I give you feedbacks. Make sure you join my Facebook immediately. Facebook page and our Facebook group. I'm going to repeat this presentation. Register for the event coming up on Sunday. Gender Selection, Prevention of Sickle Cell Disease Masterclass. You do not want to miss this event. So if you're interested, make sure you register before the deadline, which is Saturday. For now, ask your questions. It's getting to 20 minutes, our timer. If we don't have any questions at the 20-minute mark, then we're going to adjourn the clinic. But thank you so much for coming. If you have endometriosis, it's important you make use of a fertility specialist because that's the doctor that will help you to become pregnant and have successful pregnancy. Okay, Nabila, where is your question on fibroid? Please quickly do that before I go. I'm looking at 20th minute. It's 20th minute. Ask your questions. quickly, so I'll provide you feedbacks if I go. Okay, thank you for coming. My next clinic will be on Saturday, and we won't have a clinic on Sunday. Doc, can appendectomy affect pregnancy? Yes. Now, everybody has appendix. Appendix is a vestigial organ. Vestigial organs are organs in the body that pretty much, they got nothing to do. They don't have a very positive function in the body, that of which if we remove them, the body will no longer function. So everybody got appendix in their body. It's actually on the right side, the lower quadrant of the lower belly, lower abdomen. Okay, now pregnancy changes a lot of things. The state of pregnancy will complicate a lot of things. It will bring a lot of discomfort. Now, if at the same time you are pregnant, you have inflamed appendix. So inflamed appendix is called appendicitis. I don't know how they're going to manage this, because once you become pregnant, we don't normally fancy taking women for any procedure. So yes, if you have inflamed appendix, then work with your doctor. Your doctor will come up with a game plan, because it's a little bit complicated. Of course, we need to deal with appendicitis. If your appendix is inflamed, we need to deal with the appendix before it ruptures. When your appendix ruptures, they can complicate a lot of things. When your appendix ruptures, they can predispose to having abscess. When you have abscess, that's a problem. So you need to meet with your doctor. You have fibroid intramural, okay? 8, 4, that's a big fibroid. That's 8 cm. You're pregnant at 6 weeks. And they told you your baby is not growing. Now, the question is, this is what actually gets me so sad. Now, when did you know about your status regarding fibroid? To the extent of having 8 cm fibroid is big. We normally start getting worried at 5 cm. But you have an 8 cm fibroid, and it's intramural. That means it's actually on the inside of your womb. So that's the type of fibroid we normally worry about. So we normally worry about your submucosal fibroid and intramural fibroid. Now, my question is this, because I don't know, it looks like we like to complicate our life. You see, I've been preaching fibroid from day one. I've been preaching that, please, if you have fibroid, please follow up with your doctor so we can classify your fibroid and know if it's the one that will affect your fertility or the outcome of your pregnancy. Now, if you have 2 cm fibroid, will I worry? Of course, I'm not going to worry, no matter the location. But my sister, you have 8 cm fibroid. It didn't grow overnight. So you've known you had this fibroid. Then you went ahead and became pregnant. Now, at 6 weeks, 6 weeks is about the time most women will even know they're pregnant, because you won't know exactly when you're pregnant until you miss the period. As a fact. So this is very early. Now, I don't know how they told you your baby is not growing. Did you go for ultrasound? If you're going for ultrasound, 6 weeks is too early to worry. That's a fact. At 6 weeks, you don't bother about the ultrasound. We normally go for the blood work. Then later, towards the 8th week and up to that stage, you can go for your scan. So what you need to do, and I don't know if you gave them the right last menstrual period. So for us to calculate the age of pregnancy, we need to know the exact last menstrual period so we can calculate the GA. So I don't know how they arrive at this 6 weeks. So what I will ask you to do is to go for second opinion. But here's the deal. Your biggest worry should have been the fibroid. You shouldn't have been pregnant with an 8 cm fibroid. That's not good. So piggyback to your doctor. I'm sure they've told you what to do. You see, if you do the right things, you will not start looking for quick fixes. So I don't know if they told you about this fibroid and you didn't do nothing about it, then you became pregnant. Now it's a problem. Now, unfortunately, if it's confirmed you've had a miscarriage or you've had a stillbirth or you've had blighted ovum, then when you recover, please go and deal with the fibroid. Don't become pregnant with big fibroid, because some fibroids can actually play a role in miscarriage. Okay, do we have any other questions? So please, when I give you instructions, when I give you advice, please follow them. It doesn't make sense to be pregnant, you go through pain, then eventually you lose your baby for something you could have avoided from day one. Okay, so that's it for me this evening. Thank you so much for coming. Join me in my Facebook page, and I'm going to repeat this topic. Remember to join me tomorrow. Tomorrow is my traditional Wednesday clinic. You don't want to miss my clinic. Then you come back on Thursday, Friday, Saturday, then Sunday is going to be amazing. So until I see you guys, take good care of you. And if you haven't subscribed, if today is the first day attending the clinic in YouTube, please make sure you subscribe before we leave. So subscribe, click your notification, and share the good news with your friend. It's free education, free life-saving education. So until I see you guys, God bless you and bye-bye. Enjoy your evening.